Good morning. Thank you all for joining us today. My name is Daniel Muñoz. I'm a resident of Pawtucket. I'm a medical doctor. I'm a member of Rhode Island Governor's Equity Council, but today I'm here as an individual. When I start, I do want to lift up the good work that's being done on the Governor's Equity Council, the good work that's being done within the Rhode Island Department of Health. But it's important that while that good work is being done, that we actually focus on whether the numbers are adding up. Pastor Jenkins mentioned the use of high-density community often when we talk about disparities in COVID-19 vaccine distribution. But also we have to acknowledge that within that high-density community language or term or phrase, there's something else going on, right? There's BIPOC communities that live within those communities that have already demonstrated are at disproportionate risk when it comes to fatalities in COVID-19, as well as hospitalizations. The data shows that people 50 to 64 years of age who are Black and Latino are 3 times more likely to die of COVID-19. People that are 34 to 44 years of age who are Black and Latino are 3 times more likely to be hospitalized for COVID-19. And yet when we look at the allocation of vaccines, what we see are different numbers, or numbers that just don't add up in proportion to the risks that BIPOC communities are facing. We see that 14% of vaccine allocation has gone to high-density community versus 20% of all vaccines that have gone to non-high-density communities. When you dig in further, we see that even if we assume that there should be an equal amount of vaccine given to everyone, the numbers for Hispanics, Blacks, Indigenous, Asian communities is still proportionately lower. But let's be clear, we are not talking about equality here. We are talking about equity. Are we allocating enough vaccines to address the disproportionate risk that BIPOC communities are facing today? And the answer is no. We are not doing that. We are willing to work with the state administration, with the people that are doing the good work to advance a new initiative, an important initiative, which is constrained by time. And that initiative is to have a mass vaccination weekend for Black, Indigenous, Hispanic, Latino, and Asian communities in the state of Rhode Island to start making up ground. As more people in non-high-density communities get vaccinated, the communications, the media that we're hearing is becoming more and more positive, which is great, but it is giving BIPOC communities residing in high-density communities a false sense of security. And what happens then? How many of our lives will be expendable? My hope is that we can work collectively, not only as leaders here today, but as a state with state government to address the need in increasing the amount of vaccine allocations that we are giving to BIPOC communities within high-density communities. And the rest of the speakers today will address different facets of this issue. I've tried to present or frame this in the context of data. And in case there are any questions about it, I would be happy to answer those questions. But what I'm going to do now is I'm going to invite Bryant, Executive Director for Direct Action for Rights and Equality. I was just looking for you. And Bryant will be moderating the rest of today's press conference and bringing people up to the mic. And again, everyone here today is representing community and organizations that have a track record of making sure that equity is at the forefront of what we're doing in the state of Rhode Island. Thank you.